Hello, Don here. Welcome to Podiatry Practice Mastery, where we're helping you get to the $1 million mark and beyond, $2 million mark if you can. So I want to share something. I think I've mentioned this a little bit, but I tried this on a patient. It's called a rollover. So a rollover is basically you take money that they've already spent on something else and you apply it to what you're doing. So let me give you an example. I would do this for like higher cost things. So for example, if patient got a prefab, they spent $60, you could say, hey, I know you spent the 60. I already spent this. I don't want to try it for a custom. I will discount your custom the amount that you invested, like the $60. You could do something simple as well if like someone has some good feet inserts. I know you can't do the whole price of the good feet, but you say, I can credit $100 towards one of our orthotics just because you had a bad experience there, just because I think these are going to be really important. So you discount their custom orthotic, or maybe even discount the second pair if you have them get two pairs. Okay, and then this is another example. There's a patient that had done some topical laser topical for nail fungus, and it didn't really work. And so I said I will roll over the price that they spent. Oh, I spent all this money on this topical. Okay, I'll give you whatever $60 towards the laser. So just a way you can kind of roll over these expenses so patients feel like they're kind of getting a good deal. Okay, next was a 62-year-old man, Lamisil second round, 60-year-old female wart with a cantharidin. Next was a 69-year-old man, status post flexor tenotomy, digits 4 and 5, so he's doing well, no follow-up. 23-year-old female for an IND of an ingrown toenail. 31-year-old female, status post MRI bilaterally. This patient had a low-lying muscle belly of the peroneals, and that was going around the lateral malleoli region, and so that was kind of going on. So they're going to be seen for a surgical consult. Next was a 66-year-old female for a fractured cuboid. Got X-rays, 4-week follow-up. Another ingrown, another orthotic follow-up. A patient, 74-year-old patient for Q10s number 3, seeing benefit. Next was a workman's compensation. Patient, 51-year-old female. I'm going to see if shockwave would be covered versus surgery for their chronic Achilles pain. Next was a 70-year-old female that had left Achilles, doing better after PT, so no follow-up. Next was a 60-year-old that nail fungus follow-up. Had a bad reaction to Lamisil, and so because of that, she wanted another treatment, and so I'm going to plan on avulsing that nail and see if that'll make it better. Another 14-year-old male with an IND, 54-year-old female for a cyst coming from the midfoot arthritis, did an ultrasound. They're not really wanting to treat it. It's not hurting them, but I just told them what was going on. Another IND for an ingrown toenail. Left ankle pain, sinus tarsi, did an injection to the sinus tarsi. Next was a bilateral EPAT, number 1 out of 6. Next was a 44-year-old female, debrided the nail. I may do Onifix in the future for this one. Another matrixectomy. 57-year-old male for right heel pain. They've had it for about 3 months. I did for the plantar fasciitis, I did my Pelto splash flow, which is night splint foam rolling and morning stretch. And next was a 26-year-old female, number 2 out of 6, for shockwave. This is that fifth toe one. I did for the fifth toe, I do the non-radial only, so meaning I'm doing the either the soft wave or I'm doing the focused Stortz system. Next was this was a patient that possibly needs shockwave versus surgery for third tarsal metatarsal joint pain fusion, so I was recommending shockwave to see if that'll help. Next was a patient. This is a 42-year-old man. He had I think a spider bite, and he had like a big bite. So in this one, what I do, I was kind of worried about this patient, so I marked it. He was already on antibiotics, and I actually gave him my cell phone, and I asked him to text me to see how I was doing. I found that this works better, them texting me versus me texting them. I say, hey, just text me and send me a picture, and I think he appreciated that. Don't do that all the time, but this is one that I did that. Next was a status post MRI for the left foot, showed bone marrow edema. I'm going to see them back in about 2 months to see if that gets better. If not, we're going to plan on doing shockwave for that area with the bone marrow edema. Shockwave works well for that. Next was a 77-year-old female for fungus number 1. Trying to see also see status post left plantar fasciitis So she got the fungal kit. 51-year-old female, hallux follow-up for a paronychia. This was my least valuable patient. For some reason, this showed up on my schedule. I don't usually follow up for paronychias, but I ended up doing an x-ray because there was some concern. And next was a plantar fasciitis, 43-year-old female, Pelto special. They had some superficial white onychomycosis as well, so they did Formula 7 for that patient. Next was 75-year-old for left, number 1 out of 3 for shockwave. And then this patient I'm going to schedule, she also has an excystectomy on the lateral 5th digit, so we're going to plan on doing that in one of the future visits. Next was a patient that had a wavy hallux nail with slightly detached, so I trimmed it all the way back and I put Onifix on 2 of the nails. Next was an 81-year-old. This patient did nails and callus, but she also has an exostosis on the left 5th digit with a calcification. I don't really need to do anything, but we could in the future. Next was a 71-year-old female, midfoot. She had a previous bunion procedure, and she has midfoot arthritis that's hurting her. So we're going to do shockwave times 6 for this midfoot arthritis. She's going to set that up. Next was a neuropathy patient who did EBM. Next patient was a status post IND. There's another patient I did nail debridement, and I did a REMI. I don't usually do a lot of those. I'm going to try doing that for some patients to see if I get better results. Next was an MRI follow-up for FHL tendinitis. Next was a right 4th toe fracture that got a surgical shoe. Next was a left ulcer between the 4th and 5th toes that's finally healed. So there are many different patients here that we're seeing. So that is what we've been doing here. Let me see if there's any others. Another patient for Achilles. This is the bilateral shockwave. They were here for a second opinion. So I'm going to start here. I've been doing a lot of these. I try to put them all together because I was getting bored of doing them every day. Once again, if you found it beneficial, let me know, and we'll talk next time. Thanks.